Welcome back to the Beyond Clean Chemical Monitoring Expert Series, where we talk about all things chemical monitoring with our local chemical monitoring expert, Alex Hilliker, joining us for today's episode. And for the next couple, actually, is Dr. Ivan Salgo, Chief Medical and Scientific Officer at ASP. Dr. Salgo, welcome to the Expert Series. We're happy to have you on here and, invite more experts into this conversation. Before we get started, since this is your first episode with us, why don't you introduce yourself, tell us a little bit about your background.
Yeah, super happy to be here, thrilled to be here. By background, I'm a chemical engineer by training, and I'm also a cardiothoracic anesthesiologist, surgical intensivist. So this is a natural space for me, the perioperative space, environmental health, airway health, and airway breathing. So I'm super excited to talk about today's topic.
Yeah, well, we're glad that you're here. And Alex, welcome back as always to your own series. We're happy to be hosting you. As we get started in this conversation around education around hydrogen peroxide and what ChemDAQ and ASP have been doing together, why don't you kick this one off for us and tell us a little bit about what these two companies have been trying to do for the industry for hydrogen peroxide?
Yeah. Hey, Bobby, I'm happy to share the stage with somebody like Dr. Salgo. He brings an immense amount of knowledge and experience in this space, and I think it will contribute a lot to this discussion. To answer your question very simply, ASP and ChemDAQ have joined forces this year really to raise awareness of hydrogen peroxide emission safety and sterile processing. This is something that both companies care quite a bit about. Ensuring the safe and effective sterilization in hospitals using hydrogen peroxide. And actually, earlier this year, we co-authored a white paper together from a physician perspective, Dr. Salgo, and a PhD chemist perspective, our own Chief Technology Officer, Dr. Richard Warburton, which really is doing a lot to drive awareness in this space. Dr. Salgo, I'm sure you'd love to comment on that as well.
Yeah, absolutely. I mean, it's a timely topic, remains a timely topic. Fugitive emissions are important across a number of fields: aviation, manufacturing, food handling, as well as the hospital. Just recently, the Wall Street Journal had a lead article on emission safety in terms of pilots and airline personnel. So it's front and center. And I think many people don't realize that for hydrogen peroxide, it's odorless below 7 parts per million. And so I think with this fact that it's always current, environmental safety is key. It's just a natural fit for the scientific teams of ChemDAQ and ASP to come together to talk about exposure, because hydrogen peroxide exposure can have short-term effects, acute effects, skin, eyes, and airway, but it can also have long-term effects as well.
And Dr. Salgo, as we've been going through this expert series, it's one of the things that we've talked about. This is a chemical that we work with every day in sterile processing. It feels very safe. And you said the word fugitive emissions. Do you mean, not criminal emissions, but what do you mean by that, fugitive emissions in sterile processing, and why we should pay attention to it?
Yeah, absolutely. So when you look at how hydrogen peroxide works, it oxidizes things. And as I've said in the past too, we want to oxidize germs, not people. So by fugitive emissions, what I mean is emissions that are not in the chamber oxidizing germs, but actually emissions that come out at the staff breathing level. We want them controlled. And that's why all the industries, whether you work in aviation or you work in a hospital or in food handling, we want the same principle. We don't want the staff exposed, needlessly exposed to what we're trying to accomplish on the germs.
Yeah, absolutely. They've escaped, like from Alcatraz, to get out of the chamber, out into the open space. Well, this is really helpful. I'm excited to hear more about that white paper and the study that you're doing. I also know, Dr. Salgo, that you help keep a pulse, not only what's going on with research here in the States, but also in the regulatory environment and internationally. Can you tell us a little bit about, what the world is thinking about hydrogen peroxide these days?
Yeah, so historically in the U.S., what a lot of institutions talk about is the 8-hour time-weighted average. Very practically, that's the average exposure over a shift. But importantly, in the U.S., some states, but internationally, many countries have adopted a short-term exposure limit. In other words, standards may vary, but common sense doesn't, and the scientific evidence doesn't. And so what they've done actually is to say, look, there's an important not only time-weighted average measurement, but a 15-minute time-weighted average. And so that's called a short-term exposure limit. And many countries, the UK, Switzerland, Finland, have 3 and 2 part per million. Germany has as low as 0.5 parts per million. So around the world, many jurisdictions are realizing, hey, it's not just about your shift exposure, it's about acute events, like, for example, if you open a sterilizer door.
Yeah, that common sense line, I'm gonna steal that, Dr. Salgo. I like that. So, yeah, standards change, common sense doesn't. Not to say that we don't have any common sense here in the U.S., Alex, but it does seem that short-term exposure limit is an important conversation, right?
Yeah, well, I would wager to say it's coming. Some states like Washington State and Hawaii have instituted their own, and we're seeing across the standards more of an emphasis on worker safety, on staff safety. We did a whole episode in this series on the updates to AME ST58, which is the standard for chemical sterilization and high-level disinfection in healthcare. Really, the spirit of a lot of those changes was staff safety and mitigating unnecessary exposure to hazardous chemicals like hydrogen peroxide and parasitic acid. We also, earlier this year, many of the viewers will know that the revised and streamlined Joint Commission standards were released in January. There's also a link in those standards between patient safety and worker safety in the new national performance goals, as well as some of the new information about the physical environment that our team members work in the hospital in terms of implementing policies and procedures to minimize exposure to hazardous chemicals.
Yeah, well, I'm sure that we're going to get into it some more. I think we're all persuaded, audience included, that this is an important topic, right? Do you want to tease for us at all what that white paper was about between ChemDAQ and ASP and just the study and research into hydrogen peroxide?
Sure. Yeah, I can. And then we'll get into it in a little bit more detail next month. Really, it's all about understanding hydrogen peroxide emissions for 3 reasons. First is staff safety. That's paramount. Second is compliance, which we're talking about a little bit. And then the third, which I think is really interesting and we'll get into a little bit next month, is operational resilience and how mitigating overexposure to hydrogen peroxide can actually help improve the workflow in your department. So that's an exciting conversation we'll have with Dr. Salgo next month as well.
Yeah, exciting. Well, looking forward to that conversation. That is going to do it for this episode. I'm sure that there are additional questions that you may have out there about the regulations, standards, either here in the U.S. or internationally about hydrogen peroxide. If you'd like to continue that conversation, we'll make sure to include the contact information for Alex and Dr. Salgo in the description below. But until we talk to you again next time, we'll leave you as we always do here at Beyond Clean. Keep fighting dirty.